when Hope got poached, I organised that she would be transported here, that we've got facilities to work with it. So I arrived a couple of hours after her. She was quite in a bad state, so I tried to give it some painkillers, gave it a lot of drips, painkillers, antibiotics, and the worst of it all was the maggots. The wound was exceptionally badly infected, so we had to get all those maggots out. And it was actually a massive job, but she was in a real bad state. You know, she couldn't walk properly. She had quite a bad limp, and she was really in pain. She didn't eat at all, so I had to keep her inside for a couple of days. Try to feed her artificial hay. She didn't take that, so eventually we had to repeat the painkillers, get it outside, stimulate it to move all the time because she was just lying down, and slowly she's starting to nibbling the grass and eating a little bit. And once she started defecating, we were quite happy because then we know it's all going right through. So it was quite a long run until we got here, but now it's going quite well. There's a massive improvement. Obviously what we did initially, firstly we just had to get rid of all the maggots, and then we built one of these shields over the nasal section. Unfortunately it didn't last too long because she, it's itchy and sore and she rubbed it off. And eventually we had to remove that, so then we had to dart it again, take it off, clean it again. And now it's actually the 4th time that she get anesthetized, but the 2nd time that we do major procedures with her.
The pictures that I saw of her just after the dressing came off looked really good. And if I compare those pictures with this morning, how that wound actually deteriorated because it was left open. Not intentionally, but just because of practicality. It's not good. We will have to cover that wound to give it its best chance of healing. We'll just have to work on a system on how to cover such a large wound on a big animal like this.
Just giving her something to lighten this anaesthetic a little bit. Most important thing at this stage is just to get her nice and stable, get her breathing a bit deeper. Her breathing is very shallow. See if we can get her blood pressure to improve.
So the plan of action is we're just going to evaluate her now, then take some radiographs. Our time is very important, so we don't want this to be longer than about an hour and a half, 2 hours. So I think we must all really focus and work quickly.
Kan we go?
So we can see there's pieces of dead bone here. There's even a piece in front here that'll probably in time die off as well. But we're not going to remove that now. We will use that bone actually to fasten this dressing into the skull. Unfortunately, they took away, quite a lot of bone in front, which does cause a problem. So we'll probably have to suture the front part onto the skin because there's no bone there. So they did really go very deep, and they removed quite a lot of nasal bone in front. So Gerhard is now going to evaluate the wound, and what I'm going to do is I'm going to do these nerve blocks on either side of the face, specifically the nerve that runs to the horn area. Otherwise, when we work on her, although she's under immobilization, they actually tend to react quite badly and stand up when we work on them.
Gerhard's taking big chunks of bone out there. All the dead tissue is going to have to come away at some stage, so it's just deciding. The surgeons need to decide when the right time to do it is. The only reason to keep it behind is to maintain some structure to her face while the new tissue forms around it. But all the dead bone and some of the dead tissues that are still left there will have to come away at some stage.
Yes, Gerhard.
Start lifting it.
Definitely infected.
All that there.
Yeah.
It's spawning a bit.
Ja, maggots.
But yeah.
Kun je...
Can I give a bit of ketamine?
This is the worst ones, well, the worst one that I've worked on. But this is a pretty bad injury. I think the prognosis is fair at the moment. I think she will take a long time to heal, at least a year and a half, 2 years. So it's going to take a lot of commitment and a lot of treatment, but I think it's worth it. Both from saving her life, because in herself she's doing really well, and for us trying to learn how to treat these kind of injuries. I think that is absolutely imperative as well. We have to know how to treat these injuries. We cannot wait until there's 200 rhino left and then try and gain this knowledge. We have to do it now.
Okay. So, are you still taking blood?
I'm just getting up here also.
Let me know.
137.
So we've now cleaned the wound, we flushed it, we removed a lot of dead tissue there. So what we're going to do now is we're going to apply this antibacterial ointment, which is a medical grade honey. Then we're going to apply a covering, which is a calcium alginate, which can absorb wound fluid and actually provide a moist wound area underneath our wound dressing. And then we'll apply that Ligazano foam covering, which promotes granulation tissue. And after that we will actually put the synthetic casting material open. It's a massive wound. It's about 50 by 30 centimeters. And I think what the next year and a half entails is probably to treat her on a monthly basis, see how that wound heals. The first 4 or 5 months would probably be telling, in that we want just granulation tissue to get up and to fill this massive hole. And then I think we're going to have to start looking at potential complications, like the nasal passages is completely exposed, with the nasal septum as well. Even part of the nasal septum is gone, and I don't think that's going to heal properly. So we'll have to think about novel ideas how to heal that. We've now put on the synthetic casting material. We're just going to wait 5 to 7, 8 minutes for that to harden up. And then we'll start drilling. I'm just a bit concerned. I'm not sure if my nerve blocks is going to be that effective, because I had to do some guesswork, because I will normally use the horn, the back horn and the front horn as a landmark, and obviously that's completely gone, so I had to kind of guess where the front and the back horn would be. But I hope the nerve block would work like 80% effective, I hope. It's just been over an hour. The longest I've operated on Rhino has been 2.5 hours, and they were fine. Obviously, you want it as short as possible, but everything is done now. All we need to do is to fasten the dressing now to the head, which should take maybe another half an hour, and then we should be finished. So it's not too bad, an hour and a half. Of course, they removed probably 20-30% of the front part of this nasal bone. That makes it much more difficult for us to anchor this dressing into the skull, which we've done with most of the other ones. So what you'll see, what we'll probably have to do here is we can still anchor it at the back, but in the front we'll have to use suture material, and not just normal suture material, because we've done that before and it lasts about 3 days. We'll have to use surgical steel and suture it onto the skin, and just hope that will stay on there for at least 2-3 weeks. It doesn't matter, we've learned, it doesn't matter what you put on there, eventually it will come off. It's a 2-ton animal with human-made dressing on there. There's just no way that anything we do, it will stay on there. There's no way. So it will eventually come off, whether it's 2 weeks or 4 weeks.
The wound is healing quite nicely. No maggots this time. It is getting colder. The first time, I remember even cutting in the midline. There's what's called the septum, which is a piece of cartilage, and that was quite white, and you could see it clearly. Everything of that is now covered in granulation tissue, and it's 3 weeks down the line. So I really do think we're heading in the right direction. As I said from the outset, it's just going to be a long time.
It was beautiful, but we used those, and we also used the C100.
Okay. For what we...
Well, it's good for action, yeah, exactly, it's perfect. Yeah. It's perfect, and it's good in it's good in low light. It's really good in low light.
It's got night vision as well.
Yeah, I've used that too.